The Central East Mental Health Technology Transfer Center welcomes you to Availability and Accessibility of Coordinated Care in HHS Region 3. This resource was prepared for the Central East MHTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, SAMHSA, in partnership with the Pennsylvania Early Intervention Center, Heads Up, located at the University of Pennsylvania Perelman School of Medicine, Department of Psychiatry, Neurodevelopment and Psychosis section. This video was funded by the Substance Abuse and Mental Health Services Administration, an agency of the U.S. Department of Health and Human Services, as part of grant funding awarded to the Central East Mental Health Technology Transfer Center. The views, opinions, and content of videos are those of the speakers and do not necessarily reflect the views, opinions, or policies of SAMHSA. Nothing in this video constitutes a direct or indirect endorsement by SAMHSA. The Central East MHTTC supports resource development and dissemination, training and technical assistance, and workforce development for the mental health field in Health and Human Services Region 3. We work with systems, organizations, and treatment practitioners involved in the delivery of mental health services to strengthen their capacity to deliver effective, evidence-based practices to individuals. Based on regional need, we are focusing on the importance of early psychosis screening and provide information about the availability of specialized first episode psychosis resources and treatments. We believe that language matters and should be affirming, respectful, and inclusive. You will hear from family members, researchers, and behavioral health professionals as they discuss their experiences, research, policies, and practices, and offer recommendations for addressing the issue. We hope you find this informative and key to ensuring equitable access to first episode psychosis centers in Region 3. We also invite the mental health and behavioral health workforce to consider incorporating applicable information from this video into your respective clinical practices.
I was a sophomore in high school. I had different symptoms of bipolar disorder. I didn't know something was wrong, but my parents knew, and they took me to the hospital and spent about 2.5 months in and out of the hospital 3 times. I learned then that I had bipolar disorder. I had psychosis as well. That was something that I had to learn how to deal with.
I'd say around 8th grade, my son started exhibiting, some anxiety, just not being as interested in normal things that he would have been interested in, like hanging out with friends. He didn't want to go to school anymore. And that every morning became a big issue to get him out of bed, to get him to school. We'd have to drive him to school. We'd have to pull him out of the car.
Right after my 3rd hospitalization, I was introduced to somebody at University of Maryland that told me about this first episode clinic and also some research that was being done centered around first episode stuff. My parents and I made the decision to enter me into this RAISE program, and it was one of the many factors that kept me out of the hospital from then on out.
There was a very successful study called RAISE, which is the Recovery After an Initial Schizophrenia Episode, that was funded by the National Institute of Mental Health, or NIMH, to compare coordinated specialty care programs to treatment as usual. And what was found from this very influential trial was that these individuals who participated in these programs, who had a first episode of psychosis, did better in terms of their reduction in symptoms and improved quality of life after 2 years in the program.
Specialized care based on the coordinated specialty care model originated in the United States around 2015. And Congress, through the Substance Abuse Mental Health Services Administration, started allocating funds to support coordinated specialty care clinics.
And then the National Institute of Mental Health, as a research endeavor, decided to link programs from across the country into the EpiNet, or the Early Psychosis Intervention Network. And what that is there's 8 hubs across the country. All of the programs are collecting common data, and they are getting that data into a national data set. The national data set is then available for researchers from across the country to be able to quickly analyze the data and then rapidly disseminate it back into the clinical care that we're providing. There are a number of possible signs of psychosis that a teacher or a parent or another loved one might notice about their student. If someone's talking about seeing things or hearing things that other people don't notice, a decline in their grades, withdrawing from their peers, appearing confused or puzzled, not getting as much sleep, not eating well, poor hygiene or self-care, those things have declined.
As an educator in the classroom, I think the one of the big things that we notice is really a change in the mood or affect or their engagement in the instructional program. Sometimes their onset is pretty quick, that you see it as a kind of a sudden change, but sometimes you see it gradually over time.
It's always important to consider whether or not professional help is needed. So one of the things that we have on our website is a screening tool and a flow chart that helps teachers or other educational professionals make some of those decisions. We have a 5-item screening tool that asks about some different symptoms that someone may experience if they're starting to have psychosis. And then we talk about what to notice, how to follow up, depending on the responses to that screening tool. If it's reached that level where it is interfering, then the student should have a professional evaluation and possibly mental health treatment for the psychosis symptoms. Sometimes that does involve hospitalization. Sometimes it involves going to a coordinated specialty care program, such as those that are available across the country. It's important for the school professionals to work closely with the care team to think about how to re-enter the student into school or to think about some of the accommodations that they might need given the symptoms that they have experienced.
If the student is in the middle of a very heavy therapeutic intervention, that right now might take precedence over the academic demands that are being put on the student, and really working with the student and family to balance those separate needs. What we have done is definitely started with the therapeutic side of it. So again, getting those team members, whether it's the school psychologist, the social worker, the outside therapeutic provider, and just start having those collaborative conversations so that we're all on the same page and there is a consistent approach and routine. We then typically take that to the IEP team and solidify that through the IEP or the Individualized Education Program. Then what we decide as a team can then be implemented across the student's entire school day.
We have bi-weekly treatment plans where we come together as a team to kind of discuss what's going on for a young person and how we individually are working with them so that we can come together and collaborate on best approaches.
I will say that that first episode clinic saved his life and saved our family, because all of a sudden now we had a whole set of services and people dedicated to him. So primarily therapists and psychiatrists who are a team. So it's not going to one place and going to another. They're in the same place, they talk to each other. Education support, job support groups within that clinic, peer support.
It is very gratifying to see a small team of people who are really committed in the care of the young person and providing support and education to the family.
The most rewarding part is seeing the aspects of how someone's life can change early on when you have that impact.
One of my missions is to make sure that as many people as I can talk to, can hear me say, what psychosis is, what it isn't, and really address that to make a difference in the lives of people, because I know that the more we talk about it, the more it'll be like we're talking about anything else, like we're talking about other medical problems. That's what it should be about psychosis. We really want school culture to include discussion and recognition and awareness about psychosis.
Be receptive of people's flaws and know that deep down it might be tough for them in one way or another. So when you run into somebody with a mental illness and or going through something, it helps break the stigma.